Have you ever heard that 80% of determining a diagnosis is based on the history? If you're like me, when you're obtaining a history from a patient, you're creating a hypothesis of what you think is going on with the patient. You can then use objective information, such as test results or examination findings, to confirm or disconfirm your hypothesis. Since objective information can be limited in a virtual encounter, the history becomes even more important in telemedicine than it already is in traditional in-person care. When taking a history in a virtual visit, you need to focus on a few items. First, how classic are the patient's symptoms for the diagnosis you have in mind? If a patient has classic symptoms of a urinary tract infection or UTI, pain with urination coupled with urinary frequency and urgency, you can feel more confident in a history-based diagnosis. Second, how urgent is the patient's concern? Delaying care by diagnosing someone with a cold virus when they really have bacterial sinusitis is unlikely to cause significant harm, but treating a headache conservatively at home when the patient is experiencing a rapidly expanding cerebral aneurysm could lead to significant harm. Paying close attention to the presence of red flag symptoms is extremely important in determining the urgency of the patient's situation. Complicated UTIs have a higher risk of causing sepsis. Patients may complain of flank pain, fevers or chills, nausea, or vomiting. If they are becoming septic, they may have a high fever or be experiencing rigors. They may be dizzy from low blood pressure or experiencing palpitations from tachycardia. Depending on the situation, you may be unable to comfortably rule out a condition based on history alone. For example, a man presenting with painful urination may have prostatitis. While rectal or groin pain would be a red flag for prostatitis, there is a debate on whether or not history alone can adequately rule it out. This is why many clinicians refer all men with UTI symptoms to in-person care. The last set of red flags to keep an eye out for is anything that would prevent the patient from safely following the plan of care. For example, if a patient needs antibiotics but has been nauseous and vomiting, they may not be able to keep down oral antibiotics and therefore would have to be seen in person for parenteral antibiotics.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.